My name is Franz Birkholtz. I'm an orthopaedic limb reconstruction specialist, and I'm absolutely blessed to be working in one of the most beautiful towns in the world, Stellenbosch, in South Africa. We work at the Institute of Orthopaedics and Rheumatology, which is a specialist institute. This means that we have a number of specialists that are affiliated to this institute, and we provide absolutely excellent service in the orthopedic and rheumatology field. We provide this specialized limb lengthening in an environment that is very similar to a boutique hotel, where we provide high-level care and personalized attention to our patients. We focus on quality, we focus on health care, we focus on actually walking the journey with the patients. Limb lengthening is like magic, and this is why I love this field, because we can create new bone and new soft tissue from the patient's own tissues. And through a controlled process, we can make it very predictable. The technologies we employ are generally limb lengthening nails, which are almost like a pen, but it has a telescopic mechanism, and that telescopic mechanism can elongate. And because we fix the two ends of the bone to each end of that telescopic mechanism, the bone can slowly grow in the way that we dictate that it needs to happen by adjusting from the outside. Now, we can do that to restore equality between limbs that are not of equal length. So if somebody had an accident or they had infection and the two legs are not the same length, we could actually restore that equality by doing a lengthening on the shorter leg. More than that, we can also improve a patient's stature to make them taller by lengthening both sides and doing that in a controlled and safe way. Of course, when we start doing these techniques, it's absolutely imperative that it's done safely and that the patient's final outcome is as best as we can possibly do. I'm not apologetic about the fact that I limit patients' expectations. Complication rate starts rising, and it starts rising linearly first up to about 6 centimeters in the femur, after which time it becomes exponential. And the complication rate just goes to a level where it's not acceptable to me as a surgeon. One of the critical aspects of success in limb lengthening surgery is to involve a team of experts around the surgeon. The surgeon is just as good as the support structure he or she has. One of the things that we pride ourselves in is that we've surrounded ourselves with a team of experts, and what we do is we have regular meetings for breakfast around a table where we discuss patients and we discuss their journeys. And at these informal meetings, we actually give feedback to each other about our patient journeys, and it's actually very inspiring to sometimes see a patient's journey from another aspect, from another perspective. And in that interaction, we also pick up if there are safety issues, if there are red flags that we might need to respond on. But I find that very satisfying to actually walk the journey, not only with me and the patient, or the patient and I, but also with my team together. And that is really inspiring, and that is life-changing for all of us.